Hello everyone, my name is Lindsay Johnson from Latman News, and today I'm here to inform you all about the disease called polio caused by the virus called poliovirus. So the first category we'll be covering under the topic polio is the morphology of the pathogen. Under this category, I'm going to be answering 4 questions. The first question is, what is it? The second question is, what does it look like? The third question is it part of a class of pathogens? And the fourth and final question is, what is its life cycle? Number 1, what is it? Polio, or poliomyelitis, is a disabling and life-threatening disease caused by the poliovirus. The virus spreads from person to person and can infect a person's spinal cord, causing paralysis. And paralysis is where you can't move some parts of your body. And just a little side note that with polio, usually paralysis only occurs from the waist down, but everybody is different. Number 2, what does it look like? So the first image you see here is just simply the poliovirus, and it kind of looks like a planet. The second image is showing how the poliovirus attaches to the cell. And the third and final image is showing the poliovirus under a microscope. Number 3, is it a part of a class of pathogens? So just a warning here, I'm about to say some really big words, but they are only big words because they are what the virus and class of pathogens are. So, polioviruses are small, single-stranded RNA viruses that belong to the enterovirus subgroup of the family Picornaviridae species. Picornaviruses are a small group of related, non-enveloped RNA viruses which infect vertebrates, including mammals and birds. They are viruses that represent a large family of small, positive-sense, single-stranded RNA viruses. Last but not least, what is its life cycle? Here's an image of the life cycle of a poliovirus, and since the words are a little too small for you to read, I will read out the steps from 1 to 7. 1. A poliovirus approaches a nerve cell in the bloodstream. 2. Nerve cell receptors attach to the virus. 3. The capsid, protein shell, of the virus breaks to release its RNA, genetic material, into the cell. 4. Polio RNA moves towards a ribosome, the cell's protein assembly station. 5. Polio RNA takes over the ribosome and forces it to make more polio RNA and more capsids. 6. The new polio capsids and new polio RNA unite to form more polioviruses. 7. The host cell swells and bursts, releasing thousands of new viruses back into the bloodstream. Now that we have covered all 4 questions from the category Morphology of the Pathogen, we are going to move on to the next category called Signs and Symptoms of the Disease. In this category, we will be discussing early warning signs, key signs and symptoms, list affected cells, tissues, and organs, lasting effects, and visual comparison of affected cells versus non-affected cells. Number 1, early warning signs. So right now, we will be discussing 3 different types of polio. The first one is subclinical polio. The second one is non-paralytic polio. And the third one is paralytic polio. Subclinical polio. It's estimated that 95 to 99% of people who contract poliovirus are asymptomatic. This is known as subclinical polio. Even without symptoms, people infected with poliovirus can still spread the virus and cause infection to others. Non-paralytic polio. Signs and symptoms of non-paralytic polio can last from 1 to 10 days. These signs and symptoms can be flu-like and can include meningitis, fever, sore throat, headache, vomiting, and fatigue. Non-paralytic polio is also known as abortive polio. Paralytic polio. About 1% of polio cases can develop into paralytic polio. Paralytic polio leads to paralysis in the spinal cord, brainstem, or both. Initial symptoms are similar to non-paralytic polio, but after a week, more severe symptoms will appear. These symptoms include loss of reflexes, severe spasms and muscle pain, loose and floppy limbs, sometimes on just one side of the body, sudden paralysis, temporary or permanent, and deformed limbs, especially the hips, ankles, and feet. It is rare for full paralysis to develop. Less than 1% trusted source of all polio cases will result in permanent paralysis. In 5 to 10% of the polio paralysis cases, the virus will attack the muscles that help you breathe and cause death. Now we will be moving on to key signs and symptoms. Progressive muscle and joint weakness pain, general fatigue and exhaustion with minimal activity, muscle atrophy, breathing or swallowing problems, sleep-related breathing disorders such as sleep apnea, and decreased tolerance of cold temperatures. Now, I'm going to list the affected cells, tissues, and organs. When poliovirus multiplies in the nervous system, the virus can destroy nerve cells, motor neurons, which activate skeletal muscles. These nerve cells cannot regenerate, and the affected muscles lose their function due to a lack of nervous innervation. Now, unfortunately, I couldn't find much information on the lasting effects of polio, but what I'm going to assume is that people who have had polio in the past get neglected from their community because people in their community are afraid that the people who had polio still have it. So people are afraid of going near that person because they're afraid that they still have the virus when they don't. Lastly, here's a comparison of a cell with polio and a cell that doesn't have polio. Now, the next category we will be discussing is the method of entry. So there's 3 questions I'm going to be answering. The first one is, how does polio enter the body? The second, how does it attempt to bypass the 3 layers of the immune system? And the third, is there an intervention window? 1. How does polio enter the body? The poliovirus enters the body through the mouth. It spreads most often from fecal-oral contact. Usually, this occurs from poor hand washing or from consuming contaminated water or food. Sneezing or coughing also can spread the virus. 2. How does it attempt to bypass the 3 layers of the immune system? The poliovirus enters cells and replicates in 6 to 8 hours, yielding 10,000 to 100,000 virus particles per cell. One way the human immune system protects itself is by producing antibodies that engage the protein covering the poliovirus, preventing the virus from interacting with any other cell. Unfortunately, it's hard for the antibodies to keep up as the virus replicates so fast, so then it leads to your whole body being infected. It gets past the immune system because it replicates so fast. 3. Is there an intervention window? Once the virus has infected a person, there is no treatment that will cure polio. Early diagnosis and supportive treatments can help reduce the long-term symptoms due to muscle loss. People who have milder polio symptoms usually make a full recovery within 1 to 2 weeks. People whose symptoms are more severe can be weak or paralyzed for life, and some may die. After recovery, a few people might develop post-polio syndrome as long as 30 to 40 years after their initial illness. But unfortunately, there is no cure, and it can only be prevented. Moving on to the next category, transmission. There's also 3 questions in this category that I'm going to cover. The first question is, how does the microbe pass from one host organism to another? How does initial infection occur? And can host-host infection occur? 1. How does the microbe pass from one organism to another? Polio is spread when the stool of an infected person is introduced into the mouth of another person through contaminated water or food, and this is called fecal-oral transmission. Oral transmission by way of an infected person's saliva may account for some cases. 2. How does initial infection occur? Poliovirus is usually spread from person to person through infected fecal matter entering the mouth. It may also be spread by food or water containing human feces and less commonly from infected saliva. Those who are infected may spread the disease from up to 6 weeks even if no symptoms are present. 3. Can host-host infection occur? Poliovirus is very contagious and spreads through person-to-person contact. It lives in an infected person's throat and intestines. So yes, host-host infection can indeed occur. Moving on to our next category, statistics. Under the category statistics, we have two main focuses, morbidity rates and mortality rates. Both of these rates will be discussed based on current times. Current global morbidity rates. Poliovirus cases have decreased by over 99% since 1988, from an estimated 3,500,000 cases in more than 125 endemic countries then to 175 reported cases in 2019. Currently, in 2020, there are only 2 countries that are still affected by the poliovirus, Pakistan and Afghanistan. And I have no current rates for national and local, because there's no cases of polio in Canada and no cases of polio in Saskatchewan or surrounding areas. The current mortality rate for polio globally, and we will only be discussing global mortality rates because there is no polio cases in Canada or Saskatchewan, so that doesn't relate to us. The mortality rate for acute paralytic polio ranges from 5 to 10%. The paralysis can progress from up to 1 week. Permanent weakness is observed in 2/3 of patients with paralytic polio. So the last category we will be discussing in today's information video is treatment and prevention strategies. And under the category treatment and prevention strategies, I will be going over 2 things. The first one, describe the use of pharmacological drug interventions or other interventions as they apply to treatment. And the second one, what can be done to prevent infection by the poliovirus? Number 1. Describe the use of pharmacological drug interventions or other interventions as they apply to treatment. Doctors can only treat the symptoms while the infection runs its course. But since there's no cure, the best way to treat polio is to prevent it with vaccinations. The most common supportive treatments include bed rest, painkillers, antispasmodic drugs to relax muscles, antibiotics for urinary tract infections, portable ventilators to help with breathing, physical therapy or corrective braces to help with walking, heating pads or warm towels to ease muscle aches and spasms, physical therapy to treat pain in the affected muscles, physical therapy to address breathing and pulmonary problems, pulmonary rehabilitation to increase lung endurance. In advanced cases of leg weakness, you may need a wheelchair or other mobility device. Number 2, what can be done to prevent infection by the poliovirus? The best way to prevent polio is by vaccination. Only the inactivated polio vaccine shot injection is used in Canada today. An oral vaccine was once used, but is no longer because it had rare but serious risk of causing polio. And there you have it, folks. We have now covered 6 categories and answered 19 questions and statements that were within those categories. So that deserves a congratulations, because you made it to the end of the video. Almost. Before you go, I would like to tell you why I picked the topic polio. I chose to talk about polio in this information video because my great-grandmother, Hulda Holland Erickson, was diagnosed with polio in 1951 at the age of 32. When she was diagnosed, she spent 6 weeks in the hospital and had to isolate for the first 2 weeks she was there. She was all alone when she was isolating because poliovirus is very contagious and the doctors didn't want it to spread. She lived with polio for half her life and she had very minimal movement from the waist down. Her one leg worked okay, but her other leg was fully paralyzed, so that made it really hard for her to walk. She could do it with help, but not for a very long time, and so she had a wheelchair. Her wheelchair wasn't like the wheelchairs nowadays. It had 4 little wheels instead of 2 big wheels and 2 little wheels. And with her wheelchair being like that, it made it very easy for her to move around because it was kind of similar to an office chair, so it worked out really well. And although she had polio, she actually lived a very full life. She was married and she had 4 kids, my grandmother actually being the oldest, and she died at the age of 65, but she was very capable of doing many things, and I'm so happy I got to interview my grandma because I got to learn so much more about my great-grandma. Here's a picture of my great-grandma Hulda with her husband, Milford. And now it's time to celebrate because you've made it to the end of the video. Thank you all so much for tuning in today to Latman News. I appreciate it so much, and I hope you learned some useful information. Stay safe out there, and we'll see you next time.